Nice. So we have Flavia here today. She's a film editor here in New York City. What do you want to look at?
As usual, my lower back and hips and neck is a little tight too from sitting all day and editing.
Okay, so let's get you started face down, please. So Flavia, I've known for a long time. I haven't seen you in probably a good 2 months, right? A month or two?
Mm-hmm.
Here, scoot down towards me. And even more, a little bit more. But, as she says for hours at a time, looking into a computer screen, editing. And, it's funny, I have probably 4 or 5 editors that come in, and they all have achy bodies from sitting all day. There's a lot of people that work on the computer that can take their face away from the monitor every once in a while, but an editor really has to keep their head into it, right? I mean, you don't really get to,
No, I have to.
casually look away.
Right.
You have to be focused. So right away, the first thing I notice is she's super tight right in this lower back area. Do you feel how the muscle, it's even worse on here. Do you feel how the left side?
Uh-huh.
Yeah, the left side's tighter. And so I call this kind of a tune-up because she didn't come in because she's in severe pain. She didn't throw out her back or injure herself or, once in a while that happens to clients. They'll call me up and go, oh my God, I hurt my back yesterday moving furniture. But then I also have many people that are just in intense jobs with long hours and deadlines, and they once in a while they'll come in for a tune-up just to see how they look and see if they can work on some spots. So the first thing I notice is her left leg is drawing short, and when I bring it up to position 2, it evens. And that tells me that there's either something in the knee, which she doesn't have chronic knee issues. Some people do, but she's not a bad knee person. I'm gonna push into the bottom of her pelvis. That didn't really work on the left. Let me pull the right side down because there's a misalignment called an AS ilium, anterior superior, and she shows up with that. So I'm going to just, instead of taking the pelvis is tilted a little bit. So instead of pushing the left side up, I'm going to pull the right side down and also roll it a little bit. And that should level the legs. Let's try it. So I have an instrument called the activator. I'm going to find the tubercles of the sacrum, come just to the right of the second sacral tubercle, and adjust. I'm on a setting that's really good for the pelvis and the sacrum. Then I'm going to come up to the top of the iliac crest on the right. I'm going to come as much superior to inferior as I can. I look for a landmark called the spine of ischium, and I'm going straight from posterior to anterior or straight down 90 degrees. Come back to the feet, and I get the feet even already. So that's awesome. And now let's look at some of her function and see if it brings up symptoms. So I'm going to have you lift this whole leg, Flavia, like this and put it down. But do that by yourself. Try one with the right. And when you do that, do you get any tightness in the lower back, hip?
Lower back.
Point to it. Okay, right there. And I'll remember that spot. Put this leg down. And now pick up this leg. How about that side?
Not as much.
Okay, which side was harder to lift? The right one?
Left is harder to lift, yeah.
Okay, left is harder to lift, but the right one had that achy spot.
Mm-hmm.
Okay, so let's do the achy spot first. Try this right leg again. Did we get that, or keep pointing?
It's fine, yeah.
Okay, but now the left leg doesn't come up inside, so let's see. All right, I think I know what's going on there. So I'm going to adjust the sacrum from superior to inferior. This time I came straight in the middle. Now I'm going to look for a trigger point on this side. And I found one right there. Do you feel it?
Uh-huh.
So I'm at just the top of the femoral head, and I fished around to find the trigger point. It didn't take me long because I knew where to look. And now I'm digging in. That should hurt a lot. She probably feels that. So it's a really tight muscle. It gets really tender and achy. And I'm adjusting into that spot. Now lift the left leg. See if it comes up easier.
Yeah, it's a little easier.
A little easier. So we still have some stuff to do in there. So I think I'm going to work a little harder on that spot. I'm gonna fan out your leg like this, which flares out this hip joint so I can really have access to it. I'm gonna come in with my elbow a little bit and do some deep pressure work into here. Do you feel that, Flavia?
Yeah.
Okay. And then I'm gonna actually hold it with my other arm. I'm really a dominant righty, so I prefer using my right arm on almost everything. But now I'm gonna do this. I call this a windshield wiper because it looks like your leg is windshield wiping a front window of a car, right?
Mm-hmm.
And it kills, right? But I do this because I'm in an area where the hip rotates and rolls. So I want to bring that activity while I hold the trigger point. Now, her leg will probably come up easier. If not, she'll probably lie to me because she just doesn't want me to go back in there. But lift this leg up and see if it comes up easier. A little bit?
Easier, yeah.
Yeah, you didn't sound very convincing.
A little easier.
A little easier. All right, well, go
No
home.
harder than
Go
that.
home, I quit. All right, so let's do a little bit more in there. And I want to go back and I'll just check one other thing that could prevent that from lifting so easily, which is it could be hip rotation. And it is. Look how much, when I roll her hip out, or really I'm internally rotating the hip when I take the ankle out, it really made the leg go short. So let's correct that and then ask her to lift her hip again. Okay. First, let me see if I got it. That did balance the legs. Now try lifting this leg.
Oh yeah, this makes more of a difference.
All right. So you're not going to fire me yet?
Not yet.
Okay. Turn your face to the left, just your nose, and lay your head down. Is it tight that way?
A little.
Yeah. Just for the record, I made your leg go short again. Here, take a look at that. And back to center. I'm going to change the setting to more of a neck setting. Put your face straight down. And I'm going to hop up here and adjust in here and adjust in here and there. Now turn to the left and see we're starting to get some more range of motion. A little bit.
Less tight, yeah.
Less tight. Okay, come to this side. And how's it going that way?
Not as tight as the left, but still.
Feel a few spots. Okay, so go center and then left, right one more time and just tell me if you feel anything jumping out at you. And you can point to it and say, I still feel it here.
Yeah, here.
Okay, so back to center. And I'm gonna just do a few spots in here, and then here, and then here. I'm gonna pull the skin here, okay? Hear that?
Mm-hmm.
Okay. Now I'm gonna have you, I'm gonna take these shoes off. I'm gonna have you lie on your back, and I'm gonna do a few adjustments by hand. And then we'll see how that does, okay? So get onto this part of the table. I'm gonna crisscross your arms. Big breath in and blow it out. Good. Nice. Perfect. All right, so come to the center of the table. Scoot all the way back towards me. I'm going to come in and release a little bit around the neck that I saw from before. Like in there, do you feel that one?
Mm-hmm.
Nice. And then up in here on this one. Wow. How was that?
Mm-hmm.
You okay?
That was good.
All right, so lie on your side, facing me this way, please. I always like to see if you could speak afterwards. But you were able to speak, right? Come this way. That was just a little one. And then pull this top knee up like this. Let me get this elbow out. Oh, it already went.
Oh, yeah.
So I don't know if I got credit for that. A little bit more
Of
there.
course it is.
I did, thank you. All right, so come stand over on this side of the table and just move around a little, see how you feel. Yeah.
My hip's not so bad.
All right.